Welcome to the Perry Prosthetics How-To video series. In this video, our founder and prosthetist, Chris Perry, will be joined by our friend Eileen to demonstrate how to properly utilize a Rooke limb protector.
Today we're going to demonstrate a post-operative protective device for a transtibial amputee. Eileen here is 13 years post-op, so she's demonstrating, kind enough to come in and demonstrate with us. This is by the order of a physician. We have a couple different kinds. One's more rigid. This is a soft dressing that helps keep the knee in extension and offer protection from it getting banged or if a patient falls. There's different levels of protection and pros and cons for every device. This one's being used quite often, works quite well, and the patients find it very comfortable, and the healthcare providers find it easy to use. This comes with a waist strap that you can put behind around the patient's waist, and then you can run this strap down and Velcro it on to help keep it from sliding off. We're going to set that aside. This is the Rooke. It comes in, we come in, we fit this. This is adjustable in size. I'm not going to cut this one today, but I'll be able to don it without cutting it. So we open it up. This pad protects the patella. And then there are these spacers. This should be fit properly by the prosthetist. So once you're doffing and redonning it, what you have in here for spacers should be appropriate. We're going to have Eileen lift her leg up further. And what we're looking to do is find that the patella is located between these two straps. Go ahead and that's a little bit low. Right there, looks more appropriate. There's our patella. Here's the two openings. So that means we have to fill this gap here. And we can do that with these spacers. Is that comfortable on this line there? Once you have that filled appropriately with these spacers, in this case it's using both because she's got a shorter limb. We can bring the flap up over those spacers. This is the part that we have a pair of scissors. They can be cut in between these sewn sections. We don't want to cut beyond this one. I'm just going to fold this under. So if I was doing this, I would cut it here. And I would bring this over. A little bit of snug, a little bit of pull, but don't make it tight. I'm going to do the same thing at the top. We're going to bring this over. Again, I would cut it here. I'm going to bring this over and close. Then this patella support, make sure we still identify the patella is in this space. Goes on simply by Velcroing it on the sides, pulling it over the patella, and Velcroing it on the other side. I'm going to center it a little better. There we go. And then we have these straps to secure it. It's a plastic buckle. Pull it snug. And not only does this protect the limb from being bumped or falling on, it also keeps the knee straight so we don't develop a contracture. The last thing I would do, again, is if it was needed, sometimes it's not needed, is I put the waist strap around this. You can orient this strap to the front, and before you do these closures, you can slide it in on the Velcro. Let me show you that real quick. This Velcro here, you can put that right on the Velcro. That's going to hold that up to the waist strap. And then you can Velcro or clip this over. All right, Eileen, does that bother you or hurt you at all?
Nope, not at all.
Okay. Can you bend your knee? Not very well, huh? Good. So that's the demonstration of the Rooke. These are provided by a prosthetist here at Perry Prosthetics. If there's any questions or concerns, feel free to give us a call. Thank you for coming in and helping out with us.
The team at Perry Prosthetics is always available to answer questions from patients, family members, and medical professionals. Contact us at any time.